Madeline Gabriel M. Doromo, Medical Social Work Advisor of hfdb, and I'm going to provide you an overview about the Manual for Medical Social Workers, 6th edition. The overview shall cover an introduction of our bureau and overview of the Manual for Medical Social Workers, 6th edition. To start, let me give you a brief description of the Health Facility Development Bureau. The HFDB is under the Department of Health Facilities Infrastructure Development Team, which is led by Undersecretary Lilibet C. Dubin. The HFDB, headed by Director Maria Teresa G. Vera, has an administrative unit and 3 functional divisions, namely Policy Planning and Program Development Division, Health Systems Development and Management Support Division, Research and Performance Management Division. HFDB mandates are the following: develop plans, policies, programs, and strategies on health facility development, planning, operation, and management. Provide coordination, technical assistance, capacity building, consulting, and advisory services related to health facility development, planning, operation, and management. Advise the Secretary and the Undersecretary of Health on matters pertaining to health facility development, planning, operation, and management. This is the 6th edition. The cover was made to show the ultimate goal of the medical social workers of improving well-being, as symbolized by the happy faces of our clients, the letter W, and the color blue. The manual was developed by HFDB as a requirement of the Continuous Quality Improvement Program and the Integrated Hospital Operations Program. If the health facility want to be guided implementing CQI in the Medical Social Work Department, they are to be guided by this manual. If the health facility would like to implement the Integrated Hospital Operation and Management Program and achieve total quality management or transfer into a digitized system, this manual guides them in the achievement of their goal. The Medical Social Service was mandated to be established in all government hospitals in 1954. To guide the establishment, the first edition of the manual was published in 1957. The need for the establishment was elicited when WHO changed the definition of health. The second edition in 1961 was aimed at providing a clearer description of the importance of the social service. The third edition in 1970 integrated ideas relevant to the current trends or issues and new development in health and medical care under the new society. The fourth edition in 1994 was the edition with the title Manual for Medical Social Workers. It was aimed at making the MSS attuned to the current National Health Trust. The fifth edition in 2010 was envisioned to improve the direct and indirect social work practice in healthcare. The sixth edition provided for the new MSWD assessment tool and case management guidelines for 19 diseases. This sixth edition like to build on the achievement of the fifth edition. We aim to be responsive to the needs of the patients in the universal health care through the collective efforts of the HFDB and various stakeholders we were able to incorporate the best practices of the medical social workers and the latest trends and practice. The manual covered the standards following the quality requirements. Continuing quality improvement, Chapter 1, Competencies. Chapter 2 and 6, Patient Care. Chapters 3, 4, and 5, Leadership, Management, and Organization. Chapter 6, Human Resource Development. Chapter 7, Documentation and Social Work Research. Chapter 8, Monitoring and Evaluation. Chapter 9, and Sustainability. Chapter 10. Chapter 1, Continuing Quality Improvement. The first chapter focused on CQI because it sets the tone for the whole manual, being the framework. Oftentimes, the Bureau is asked, what is the difference between the standards we develop and the standards of the licensing and PhilHealth? The standards we develop are called developmental standards. We are aspirational, meaning we strive to attain it, so we will achieve quality services. Licensing standards, on the other hand, are safety standards that may be extracted from the developmental standards, with the requirement of them being attainable by the most of the health facilities being regulated. The same can be said with PhilHealth. Chapter 2. This chapter is all about the medical social work practice in the Philippines. It provided the following: definition of medical social work, professional standards for medical social works, like Standard 1, medical social work shall have knowledge and understanding of how the medical social work practice was developed to learn from it. Standard 2, medical social work shall have knowledge of the code of ethics, guiding principles, and core values of the practice to be guided in their decision-making. Standard 3, medical social work shall have a cultural competence. Standard 4, medical social worker shall have knowledge of patients' rights. And Standard 5, medical social worker shall have working knowledge of current theories and practice. And Standard 6 is medical social workers' professional skills in providing intervention to their clientele. Standard 7, medical social workers shall have an understanding of the Philippine health system. And number 8, the medical social worker should have knowledge and understanding of the relevant facility-based programs that influence MSWD systems. Chapter 3, Medical Social Work Department. This chapter discusses the following: objectives and clientele of the MSWD. Likewise, the chapter discusses the standard functions of the Medical Social Work Department. Standard 1, social work case management, that includes psychosocial assessment and psychosocial intervention. Standard 2, managed care, which include pre-admission planning and eligibility study. Number 3 is the MSWD shall have social group work as intervention. Number 4, community organizing. And number 5, social action. If you look at your screen, these are the functional chart of the MSWD and the different activities for each unit or section is listed below. Okay, Chapter 4, Medical Social Work Department Systems and Procedures. This contains the 22 procedures of the Medical Social Work Department. Chapter 5. In the 5th edition of the manual, we were able to provide case management guidelines for 19 diseases and special circumstances. In this manual, we did not update these guidelines because we wanted to gather evidence of their effectiveness. The chapter instead discussed how this would be done with collaboration with all participating health facilities. The chapter shall be issued as a separate manual once this evidence have been compiled. Chapter 6. This is the leadership, management, and organization of Medical Social Work Department. This chapter is dedicated to providing guidance to the chiefs of the department and to the supervisors. It contains the different standards of administrative functions, such as planning, programming, budgeting, and financial planning, policy formulation, organizing, and governance, facilities and equipment. So we have a layout, physical layout of the facilities or the office of the MSW. Staffing includes the proposed staffing pattern, basic qualification and responsibilities of different position levels, recruitment, selection, appointment, and responsibilities, volunteer management, workload and caseload management, leadership and directing, communication, meetings, hospital committees, both clinical and administrative, public and human relations, conflict management, controlling, resource mobilization, recording and record keeping, health and social policies. Chapter 7, Human Resource Development. Chapter 7 is about human resource development and discusses Philippine qualification framework based on PRC presentation. Standard on Human Resource Development Program was discussed. These standard programs are annual training plan, orientation of students, trainees, visitors, observers, and newly appointed medical social workers and other healthcare providers. Human Resource Development Plan, professional development, kinds of training and education for medical social workers, continuing professional development, in-service training, self-study, design of certificate training for medical social workers, design for certificate training for managers of the medical social work department, design for certificate training for trainers, training of trainers, affiliation program, teaching and training function of hospitals, and clinical social work in health and mental health specialization, rewards and recognition. Okay, chapter 8 is about documentation and social work research. It discusses the different 36 standard documentation forms. These 36 include the two assessment tool, one for the elderly and one for the children, and the 3 reports, which are statistical, narrative, and psychosocial profile. Chapter 9 is monitoring and evaluation. It contains the guidelines for focus group discussion, patient experience, and the self-assessment tool. The self-assessment tool shall be an instrument for the medical social work department to evaluate improvements in the compliance with the standard. The tool followed the input, process, output framework, and it has 22 pages. It has a rating system to determine the need for technical assistance. Chapter 10, Sustainability. This contains the different strategies to be able to sustain the implementation of the standards stated in this manual. Number 1 is develop an advocacy program for medical social workers as a healthcare provider. Number 2, cascading of the manual. We have a orientation video. This one will be cascaded and uploaded for the information of all health facilities. e-learning platform. We are developing an training that is in an e-learning format, working towards the specialization program with PRC, DSWD, IPO, PASWI. Coordinate with civil service on qualification standards, strengthen the monitoring system, include the research addenda study on the indicators and evidence for the case management guidelines. So, 10 years ago, we issued the 5th edition. What do the social workers say about the manual? It helped them improve their practice, case management, strengthen their roles in the medical team, guide them with their decision-making, and help them attain their higher education, attain ISO certification, and the best of all, they became better professionals. Manual for Medical Social Workers 6th edition has been disseminated through Department Circular Number 2022-0434. You may access the digital copy of the manual through the link posted on your screen. There are other hfdb programs. Allow me to share the list with you. So we have programs addressing systems, health facility programs, projects, and databases. If you have any concerns, questions about the manual, you can contact us through the number in your screen and also the email address in your screen. Maraming salamat po sa inyong pakikinig.